Already up to about 100 participants, and the number's climbing. So thank you for joining us, and we're going to be getting started momentarily. And thank you all for taking your Saturday morning to be with us to discuss reopening, a safe reopening for the upcoming school year. I'll give another 30 seconds for people to make their way in. Then we'll get going. All right, looks like it's starting to slow down a bit. So we will begin the proceedings for this morning. So welcome everyone and good morning. My name is Jelani Haynes. I'm one of the community engagement managers within the Office of Student, Family, and Community Advancement at BPS. So to every parent, teacher, student, support staff, community and city leaders, we are extremely grateful for your presence this morning for our discussion and our meeting around reopening. I want to take a moment to introduce you to the people that you're seeing on your screen. Again, my name is Jelani Haynes, and I'm a part of the community engagement team. And I would also like to introduce my colleagues from the community engagement team, our director, Miriam Ortiz, and co-managers, Crystal Cummings, Albert Cruz Davis, and Denise Rory. I would also like to introduce members of our from our leadership team. We have Tess Atkinson, Assistant Chief of Staff, Monica Roberts, our Chief of Student, Family, and Community Advancement, and lastly, Superintendent Dr. Brenda Caselius, who will be providing the presentation that you will see this morning. And to any of our other district leadership that might be on the call and the audience, we thank you for joining us today. Just to give you a little bit of background, this is our 4th webinar and our largest meeting to date. So we thank you for your engagement and for your time today, and for those of you who have participated in previous meetings. This is our 32nd community meeting since June regarding the reopenings, and we've had the opportunity and the privilege of connecting with a variety of stakeholders across the district. We've connected with youth and youth organizations. We've had several meetings within our English learner community and for our English learner families. We've connected with our SPED families. And within BPS, we have engaged our principals, teachers, nurses, custodians, and our many partners and advocates. And we are very appreciative for everyone's insightful recommendations, suggestions, and questions around the reopening of schools, and especially and mostly for your willingness to come to the table during these extremely difficult, stressful, and uncertain times. So just to just to discuss what the objective is for this morning. Our objective this morning is to get your thoughts, your suggestions, your suggestions and concerns around fall reopening. And we also want to be able to try to give you some insight on where the district is in its planning for reopening. So we will have a welcome now from the superintendent and a presentation from the superintendent, followed by a question and answer session. Again, we thank you for your time, for your attention, for your presence. And now I will turn things over to Dr. Brenda Caselius.
Well, I'd just like to thank the team again for the incredible outreach that you all have been doing over the past several months to make sure that we listen to our community, that they have the opportunity to ask questions and spend time with us as we begin to think about what school might look like for children during this incredible time in our history and the devastating impacts of COVID-19 and what it's done to our community. We know that it has disproportionately impacted our Black and Brown communities within Boston and across this nation. And we know that, this has been incredibly troubling to us as we begin to think about how do we meet the needs of children educationally, as well as their social emotionally needs, and support their families. This has been incredibly hard since we closed doors on March 17th. And we began to feed our children of Boston, not just Boston Public Schools children, but anyone who came to our door. We've We've put out over 1.5 million meals. We've delivered 32,000 Chromebooks and have provided 15,000 mental health sessions to our students to ensure that they were getting their needs met in terms of outreach on emails, outreach on text, or telehealth with our over 80 providers that we have to support our youth. Also been meeting almost weekly with our Student Advisory Council and getting really great ideas from them. And also this team here that's with me today has been meeting across all sectors to ensure that both internally and externally to the organization, we are getting the right kind of feedback that we need in order to think about reopening plans. As you know, school ended on June 22nd, and we were in remote learning then from March 17th through June 22nd. Then we quickly shifted to do summer school, and we doubled our summer school numbers to have more kids engaged in summer school. And summer school it started on July 7th and just ended on August 7th last week. And so we're really proud of the efforts that we did to shift really quickly and get summer school up and working with our Boston After School Beyond partners and some of our nonprofit partners as well, and some of our faith-based community. And I want to just take a moment to thank everybody for the outreach that you did to keep our children engaged safely this summer. Then we shifted quickly to release a draft framework on July 22nd that to our school committee that talked to the 3 different models that the state is requiring us to turn in: an all remote model, a hybrid model, and a all in-person model. We quickly realized, because of the transportation guidance that came out 2 weeks ago, that the all in-person model was a model that we just couldn't do because transportation requires to have less students on the bus, and we couldn't purchase or double our buses, so we had to lessen the number of students that were safely going to be able to be transported to school. And then after the July 22nd meeting, we quickly pivoted to include more teacher and school leader voice in that draft framework to put what I like to say more meat on the bones, and to really begin to dig in since July 27th with very intentional working groups to edit those drafts and to begin the conversation around reopening. And then just this past week, we went even deeper into that draft. We released a copy of a draft to the public that more defined our safety, our operations, and our academic planning for the upcoming school year. We are taking feedback into that all this week and next, and the plan is due on August 14th to the State Department of Education. And in that plan, we will favor one or the other, remote or hybrid. We have heard loud and clear from many in our community that they still feel very unsafe for a hybrid reopening. And so we are taking those that feedback very seriously as we make our considerations over the next several days for what Boston Public Schools will do. But these are just draft plans going in currently. Our teachers and our school leaders are still working every single day to determine what is in the best interest of our children, of our families, and of our whole community. So no decision has been made at this point. So I want to be really clear with folks who are on this call that a decision at this point has yet to be made. That decision will be based in science. It will be based in what the community has told us. It will be based in a collaborative structure with the mayor and with Chief Martinez and the Boston Health Commission. That is not a decision I make on my own. It is a shared decision. So we are continuing to deliberate, have some meetings early next week with the mayor, and had some meetings this week with the mayor. And so we will continue to look and get that to all of you as soon as we possibly can. I know people are anxious for their childcare, they're anxious for their family situations, and they want to know, and we know that you want to know. And so we want to be respectful of that and get you the information as soon as we possibly can. So with that little introduction, I'm going to go ahead and tell you just a little bit of details. I'm going to be very quick on a deck that I have prepared, maybe in next 5 to 6 minutes on this, and then I'll take your questions for the remainder of the time. Next slide. One of the things we really want to do in a remote environment or in an in-person environment is to create joyful, happy learning environments that accelerate student learning and also help to support their social and emotional well-being. Next slide. Some of the core values that are driving our work are that we are concerned on student safety, staff safety, and also the safety of our families, as well as the community as a whole, and the spread of this virus. We, of course, are going to have all of these decisions grounded in science and in what the health medical professionals are telling us. And we are also using our equity analysis and toolkit and have been meeting with groups to help fill out our equity analysis, which is almost finished. We also really believe and value community engagement. I was talking to some of my colleagues and said that they've had 2 hearings and to know that we've had over 32 different opportunities for internal and external stakeholder buy-in, and these large webinars has been heartwarming to me that we are doing such a broad reach to really understand the feelings of our public and understand the feeling of our students, our teachers, and our families. And then also another huge value for us is around just the quality of learning. What did we get right in remote learning and what did we not get right? And how do we fix those holes if we end up in an all remote situation next year? And then also how do we improve upon in-person learning if we know that it's going to look very different where we are socially distanced or having to have new safety protocols for students. And we want to be able to know that we are supporting both our staff and our students if there are underlying conditions or other considerations or exceptions that need to be made. Next slide. So as we think about reopening, we are thinking about the remote model and the hybrid model and how we do improvements around those for our students, K0 through grade 12. We also have significant planning and have ordered protective equipment for our students and our staff. And we have those orders, some are here and some are on the way. I want to thank the Red Sox for their donation of masks. We also know that we have budgetary restraints. This is going to be hugely expensive to the school district. This is not just expensive to Boston. It is something that we are working with our federal legislators on, as well as our state legislators and our governor and State Department and city to ensure that we have the funding that's necessary to get reopened, whether that is remote, and any new technologies that we need for that, or any other considerations for staffing or food costs or busing or delivering food or additional mental health supports. There's just a lot of additional costs to the seriousness of the situation in which we're in. Also then human capital, we've done a lot of our hiring already. And so there will maybe be staff that are unable to come back to school, may request a leave. So we need to figure out how we bargain with our union around their working conditions and what that looks like for them. And then of course, transportation, which is a yearly problem for Boston Public Schools anyway. We had hired a transportation expert to get it right this year. And of course, now with this curveball that was thrown to us, transportation is going to look very different. Next slide. So some of the safety and facility protocols we've been doing for several months now is walking all of our buildings, measuring them for capacity, checking out our HVAC systems, fixing windows, because as many of you know or have been participating in previous webinars, for CDC guidance, you must have airflow and proper air quality. To do that airflow, you must have a window open in every classroom, and you must also or have HVAC systems and clean filters. We have ordered all the filters, have a replacement strategy for all of our filter protocol. And then our windows, we had 92 windows that were not functioning. And as of a week and a half ago, there were still 22 that we were working to fix. And I haven't gotten that update on Friday, but I'm told that they will be ready by start of school. And if they are not, then those classrooms would just be taken offline and be deemed unusable. This is also true of our basement spaces. I know that some of our classes have basement spaces, or some of our staff have been in rooms that don't have window. We are not able to have our staff in rooms that do not have proper ventilation. We also have upped our cleaning protocols, cleaning, decluttering, and how we replace our trash bags, how we clean our bathrooms, availability of cleaning supplies, types of cleaning supplies, cleaning our faucets, cleaning our water distribution bubblers, and making sure that we have all of that on a protocol. And then, of course, having reminders and signage and other things available throughout the building so that people are very clear on what the expectations are and how we're going to be following those as a community. So again, there are 3 different models that we were looking at and trying to flesh out and better understand, and that is both remote learning, which we did this past spring, but we know we can do it better. And so we will be planning for that and the data systems that are going to be needed and the technology that will be needed for that. Every student will have a Chromebook and access to Wi-Fi. And then we have blended learning models, which is a little bit of both of in-person and remote. And then, of course, the on-site in-person school model, which we have ruled out. That is not a possibility for us right now. The in-person model will require additional staffing and also looking at new models for teaching our students. Next slide. So the next steps here, I shared a little bit in my intro for where we are, is that we're continuing to discuss working conditions with our union partners. This is our last community meeting, so we will have opportunity still to give feedback on our website at reopening, I think, at bostonpublicschools.org. We'll make sure we put that in the chat so people have that. We are finalizing our equity analysis and have been meeting regularly with our equity roundtables. We will still continue to do that throughout this entire pandemic. Matter of fact, it's a best practice now at both the district and the school level that there is an expectation. We will be meeting with our equity roundtables to take problems of practice, to look at our data and hold ourselves accountable to what we say are guardrails and our values. We're continuing to monitor our supply chains, making sure that our technology is coming in, making sure that our PPE is coming in, and making sure that we have all of the necessary protocols in place. We also are adjusting our plans based on feedback. You will see that when we release our draft 2 and adjusting timelines if necessary. So we will continue to update you. You can continue to find out more information at bostonpublicschools.org. And for the latest information, we'll have that up there. We'll also be texting parents, robocalls, and providing letters to them. We are also continuing to work with our school leaders. They will be back to school next week. We have an institute, a yearly leadership institute, where we will be taking an anti-racist lens and giving professional development to our school leaders and central office staff around anti-racism and standards-based education. We will also be working with our school leaders to walk their school buildings to better understand and lift up any areas that we may have missed, because they know their school buildings best. They'll be doing that with their nurses and with their teachers. They'll also be meeting with their parent councils and their site equity-based teams to make plans for their school-specific reopening, whether that is remote or in person. We need to have those plans happen at the school site level so that parents at the school site level are fully informed of the planning moving forward, and then they'll submit those plans for approval. And so at this time, I'd like to entertain your questions and suggestions and ideas, and I will turn it back over to my team. Thank you.
Thank you, Dr. Cassellius, for that presentation, and thank you to our families for your time and for your attention to that presentation. And I know that that was a good bit of information to digest, so we're going to dive into that information more now by way of our Q&A session. And I'm sure that a lot of folks have questions and concerns, so at this time we will open the floor to you, our participants. So before we begin the Q&A, I just want to, we just want to begin to set some expectations and some guidelines for this portion of the agenda. We will be taking mostly live questions from participants who have their hands raised. Occasionally you will hear us read out some pre-submitted questions that we've been collecting over these weeks. Please, we're asking that participants please keep questions to 1 minute to allow for other participants to speak so that we can have as much input and feedback as possible. And even more so, we would like to honor the needs of our most vulnerable families and populations by asking that during the Q&A that we intentionally prioritize their voices. So we trust that you will honor that part of the process with us, given the high level of anxieties that our EL, our SPED, and other vulnerable populations and families are experiencing at this moment. We also invite parents that are essential workers to offer their comments as well. And again, as we said, we want to prioritize those voices, but we hope to hear from as many people as possible. If you're unsure on how to raise your hand, you will just need to locate the button that says participants at the bottom, the center and the bottom of your screen. You'll find your name, and then you will click the blue raise hand button, and you will then be in line to be called on. So with that, I'm going to ask Alba and Denise to help me with the calling on of our participants for Q&A, and I see that we already have 18, or make that 19 hands raised now. Alba, if you want to call on our first, I'm sorry, Denise, if you want to call on our first participant.
Thank you, Jelani. And good morning, everyone. So Nicole F. is our first person to offer their comments. Good morning, Nicole.
Nicole, are you there? Sure to unmute yourself.
Hold on 1 second. Nicole? Okay. You were with us for a second.
Yeah, I heard the microphone. We can come back.
Is that better?
Hi, Nicole.
Hi, so I had you on my headset. It wasn't working very well. My daughter is from Charlestown High, and she's on IEP. Now, when we went to just the online, she had a very difficult time with the online learning. She needs extra help, and the online learning wasn't giving that to her. Teachers were trying, they were calling, checking in, and trying to give her the help, but she wasn't meeting her needs. So I'm hoping that if we do the hybrid instead of just the online, because she needs to be in school also along with being online, she needs a little bit of both. I want to make sure she gets that opportunity to do so, because I know there was supposed to be a survey going out to ask parents what they wanted to do, and I've never received that survey. So I just want to make sure, because I know a lot of parents want to keep their kids home, and that voice is very loud, but the parents that want to make sure we do the hybrid too, or if we can, their voices are also heard.
Yeah, very much. Thank you, especially our students who are receiving services that they really do need. We have heard several families say that they would like some sort of in-person option for that, or some sort of way to receive those services. So we are working with our families on what those exceptions might be. There's also been the suggestion to phase in some of the services for some of our students who need those services. So we are taking all of that into account right now and seeing how we could meet the needs of children the best that we can. It obviously is very different for every single child. They have different needs, whether they're medical needs or behavioral needs or some other type of occupational therapy or speech therapy or something like that. Some of those can be delivered remotely, and some do require in-person care. And so we're working on that. We don't have all of the answers just yet on how that will work. It also matters what the community spread is and what the governor or the Boston Health Commission has said in terms of sheltering in and what the requirements are around that. And then also the type of PPE that would be required if, say, we were toileting students or helping with any kind of medical issues that the student might have that would require us to be closer than 6 feet.
Thank you, Dr. Cassellius. Thank you, Nicole. Next, we have the next three. We have our Jennifer, Damali, and Aaron. My apologies if I'm saying your names incorrectly. And again, at some point, we will have Alba read off a couple of pre-submitted questions.
Great. Jennifer?
Hello.
Hi.
I am a teacher in a sub-separate classroom at the Jackson Man School, which was having some air quality issues and are possibly being closed in the future due to the condition of the school. So that's a real concern of mine. My other question is, what supports will be put in place for if we do return back with special education students in regards to, I know we've talked about PPE and stuff like that, but will the ratio be the same? Because I'm thinking, how am I going to be cleaning when the 10 students and 3 adults was already kind of an issue previously with safety and things like that? Thanks.
Yeah, so again, we don't know if we're going to be back in person, but if we are back in person, then every school would have to have had a sign off for air quality and the cleaning protocols in place. I do think that we will probably be depending on students and teachers to help us, like with cleaning of desks and that kind of thing, because it's just obviously a big job to do all of that. So we will be like a village if we come back into cleaning. As for students who have specific needs, we will figure out ratios with the school principal on how many students are going to opt out. The caller before was talking about having a survey. We will allow families to opt out. So we will be making those calls if we decide to go in person or hybrid. And we'll be doing that shortly in the next week or so, depending on when we make this decision. And asking families, directly, are you going to send your child to school or not? And then that will tell us what the numbers and ratios will be for each staff person. But no matter what, we can't have more than the students that will fit 6 feet apart in a typical classroom.
Thank you, Dr. Cassellius. Thank you, Jennifer. And next we have Damali.
Hi, how you doing? You guys can't see me, can you?
We cannot.
Okay,
We can
great.
hear you though.
I just wanted to make sure. Hi, Brenda. Hi, everybody. Thank you again for having this meeting. Let's see. So you have no sanitation supplies, no PPE, and did you hire the extra janitors? I know this is a lot. You only said 1 minute. If I can get 2 minutes, if there's still only 18 people, we got to 11:30, right? So, and why don't we test the people that come in, have them get tested? If we have to get vaccinated and tested before kids get into school, period, why can't we have the COVID-19 test? I don't know if that's because of supplies. And yes, it's still not safe. If you don't have those things, kids cannot go back to school. I felt kids cannot get back to school, period. Also, you said it's being recorded. Now, does the mayor get to see this? So if he does, I hope so. And remember my name, Damali Simmons, please. It's very important that the kids do not go back to school because there's no supplies. Doesn't make sense. So we can't protect our kids if we don't have no supplies. Again, thank you so much for having these sessions. I'm greatly appreciated for it, and everybody please stay safe. Thank you.
Thanks, Damali. I don't know if I miscommunicated, but we do have PPE. We will have that available. We will have our cleaning supplies available. The windows will be fixed. So I just want to make sure that I'm clear that we will have all of those pieces in place prior to school start. And testing is something we're still looking at. We're hopeful for mobile testing, and there may be some tests who are given to some faculty who have to go from school building to school building or are at higher risk. So, or if they were sick, testing is required for them to have a positive, negative test prior to return if someone does leave the community. So those health and safety protocols are in place, but we're still trying to figure out how we would do any kind of regular testing availability for people within the community. We do not have an answer just yet for that if we were to go in person.
Thank you.
But I know that testing is also widely available in Boston for people who do want to get tested. Even asymptomatic testing is available for people throughout Boston. You can go to the Boston City website if there's anyone on this call who wants to get tested.
Thank you. So we have Aaron is next, then Naja, then Tammy. So Aaron, you can unmute yourself. Good morning.
Good morning. Hi, how are you?
Doing well.
Thank you. Thanks for taking my question. I wrote it down, so I won't, go off track. I believe we can all agree that those who will most directly be impacted on a daily basis by whatever plan you decide on will be our students, teachers, and parents. Now, much has been made of your meetings with like nurses, teachers, parents, and general stakeholders in things like focus groups, town meetings, feedback surveys. This is all great. However, focus groups, town meetings, and surveys are not the same as decision-making power. And I'm not currently aware of any of those primary stakeholders being actual members on the planning teams. Again, this is not the same as having those teams meet with stakeholders. And so my question is, would you commit to giving decision-making influence to at least one parent, one teacher, and one nurse on the actual planning teams? And if not, can you explain what the rationale is?
So the planning teams they were appointed by the BTU and some of our union partners. And so they do sit on those working groups, and that feeds right up to the steering committee, which feeds right up to my executive team. So all of that feedback is considered. It is put into the planning and brought up. And then the really big decision around whether you go remote or whether you go hybrid is a collaborative decision with the mayor and also the governor, obviously, and state commissioner of education. So those are kind of all of the approval processes that need to go in place. And then also the school committee members, I've been keeping them abreast as well.
Thank you. So we have Naja, Tammy, and then Lydia. Hi, is it Naja?
Naja.
Good morning.
Good morning. Thank you. I had a question. So my son, he actually did really well with remote learning in the spring, and me and my partner were really engaged in, in his work, and his teacher did a really good job. So one thing I did want to know with the kids coming back in the fall, whether it's remote or hybrid, because I do plan on keeping him home and having him do remote, is the learning gap. Because I did notice that there were a lot of students who did not join the Zoom calls, who were not engaged in the remote learning. So for someone like my son, who was very engaged and actually did very well and excelled, what happens with that learning gap now in the fall when students who maybe haven't done much since March go back in classrooms or remotely with students who excelled or are on, at their level.
Great question.
Thanks for the question, Naja. We do know that some students engaged more than others did. Some teachers had a easier time with it because they really understood the technology and understood how to keep students engaged. Some schools had better systems for following up on students and families where they maybe struggled. And we know that families, working 2-3 jobs didn't have the opportunity or support in order to help their children to get online at the time that maybe class was going on, or was confused about how to do a Zoom classroom or how to get turned on. So there'll be a lot more training and opportunity for parents through meetings with their family liaisons, with their principals, with their teachers, to get parents up to speed on all of the new technologies. And then we'll have new data systems that we are putting in place to capture whether kids are engaged or not. And then teachers are going to be personalizing learning a lot more than they have before, with understanding where their children are, where maybe some of the learning loss was, and then working with their paraprofessionals and other teachers within the classroom and other professionals within the school building to help augment that learning and help to accelerate their learning. So we'll be depending on our wonderful teachers to help understand where kids are in their learning so that we can help get them accelerated and back up to grade level standards.
Thank you. So we have Tammy, Lydia, and then Ariel. So next we have Tammy Hammock.
And Tammy, right before you unmute yourself, or Denise, right before you unmute her, I just wanted to say, because I forgot to include this in my opening remarks, we are recording this meeting just to be sure to be able to capture your feedback accurately. And we are also gathering written notes from your questions, comments, and suggestions. So that's all I wanted to say.
Thank you. Hi, Tammy. Good morning.
Good morning. Thank you so much for taking my questions this morning. So mine are regarding transportation. My daughter goes to the O'Brien in Roxbury, and like the vast majority of 7 through 12 students is required to take the MBTA, Boston public transportation. On any given time, the 66 bus in the afternoon is jam-packed with students waiting for 3 or 4 buses to even leave the school. What kind of influence do we have on the MBTA to make sure that we have adequate and safe public transportation for all of the 7th through 12th graders? And what is the plan for making sure that they make a priority for picking up kids? And the other part of that is because of colleges coming back in the fall that are taking public transportation, what about going back to September 16th to see if those college students are now bringing more disease on the T because they're from out of state?
Yeah, thanks, Tammy. We've also had that as a concern in terms of the capacity of both the subway and the buses through MBTA. We are working with them actively on routing, and as we are our own routing, to ensure that we have, not those crowds that happen. I'm not a transportation expert, but we are actively working with the MBTA on capacity.
Thank you. So we next up we have Lydia, then Ariel Goldman, then Kane. And I just want to let folks know we have about 36 hands raised because I know you can't see that on your side. So next we have Lydia.
Hi, hello. Can you hear me?
Hi, good morning.
Good morning. Some of my questions were previously asked as far as transportation and what Ms. Simmons had stated earlier as far as, it not being safe. For myself, my daughter, she goes to New Mission, and I didn't receive, also, if I did, I apologize. I must have went over it through my email, not realizing that it was the survey to opt in for whatever it is you wanted, how you wanted your child to learn. But I didn't get it, and I would choose remote learning only because for myself, I have a rare disease and I'm on immunosuppressants. So my daughter going to school, whether they have PPE, she's still taking a risk and a chance. And if that was to be brought back to us, because it's not like the symptoms kick in right away for this disease. That's why when Ms. Simmons earlier stated, you know, are they doing COVID testing? How are they going to go about monitoring these kids besides, you know, offering them, you know, doing the social distancing while they're in school, or, you know, are they going to do COVIDs on the children as well? That was a good question because, like I said, for myself, it's taking a risk, and I would rather opt into remote learning. And would I still have the opportunity to fill that form out so that she can stay home and do her online learning, because she did really good with it. That's basically what my main concern is. And also she is on a school bus. So that's another thing. She's not just risking being in school around people, but on the school bus as well. So that's my concern.
Yeah, thanks for that. And we do have a cleaning protocol as well with the school buses, and to clean them between their routes, and also one student per bench. Windows have to be open in the school bus. We have to have monitors on school buses. So there's, you know, a lot of protocols that are in place to try to keep students safe that way as well. But I do hear you in terms of, you know, your own personal health risks, and value that feedback that we have a number of our families. Matter of fact, 24% of our students have underlying conditions as well, which is troubling, you know, either asthma or diabetes or sickle cell or other concerns, or they're medically fragile themselves. And so, you know, all of this is very serious, and has been taken into consideration as we think about and deliberate what our final decision is as we open school. Parents will always have the option to opt out for their own particular necessities for their family, or for the health of themselves or their child.
Dr. C, could you just explain to folks that about the survey in terms of choosing what you want to do that hasn't gone out yet?
Well, there was a preliminary survey that we did, and we kept open for several weeks just to get a sense of what people were thinking. As we get closer to actually opening up, that has shifted somewhat, because, you know, we had a number of people saying, yes, we want our kids back. But as the, you know, there's no vaccine in sight, there's, you know, still a lot of worry. We're still watching the numbers in Boston and Massachusetts not go down, and maybe even tick up a little bit. That we are very concerned, and especially since across the nation, as the one caller said, we are seeing surges, and our college campuses are now having students potentially return from many different parts of the country, and actually internationally. And that, of course, is also a concern to the community, and whether that might increase our numbers. So we're watching that all. I know a number of colleges have recently said, no, we're not going to do in person. They've shifted their position as well. So I think that it's, you know, as we begin to really get serious about, you know, we're getting closer and closer to what was calendared as our start date, and really having to make a decision really fairly soon, probably this week or next. I'm hoping this week because I know parents want to know.
Thank you. Next we have Ariel.
Hi.
Good morning.
Thank you for having this meeting. I have two kids. One is entering first grade at the Hurley, and the other will be entering K0 at Westzone. Last spring was really rough for my K2er at the time. And when I was pressed about it, I said I wanted a hybrid if it was safe at all. If there was any way to do it, I said I would take, you know, 7 non-consecutive hours a week, and I would send him in a scuba suit. But at the time, it never occurred to me that that would make the online version of school worse. And now with the synchronous teaching of the in-person and the online students, I can't imagine what that's going to look like. Does that mean that when he's taking online lessons, and my 3-year-old also is taking online lessons, that their teacher is going to be in a mask to protect the students in the classroom? And they're going to have to be learning from a teacher online who is wearing a mask and is occasionally like walking away from the camera and not facing the screen? Because I don't know if they're going to be able, I mean, already it was so hard for them to focus on the screen. And adding those extra layers of things is just, I can't imagine doing that.
Yeah, you know, really good comments. None of this is easy, and none of it is going to be ideal, and I'll never replace what we had in September of 2019, where children could walk in the front door and get hugged from their teacher and sit down on the carpet and do their morning song and have their morning meeting and get started right into their day. You know, it just is going to feel very, very different and be very challenging. And the technology will be something that we will have to get used to and have to continue to improve upon and better understand. Also, co-teaching models, the use of paraprofessionals, and the use of you know, project-based and independent practice will be another big piece as we think about moving forward. So, you know, obviously hybrid is not ideal, and you know, there's just no good answer all around. Some folks, some of our kids have struggled in remote, and some kids, you know, are just not able to come to school in an in-person environment as well. So we'll just continue to work through and put our best thinking on it and take all that feedback and try to take the next right step for our kids.
Great. So we have 43 hands raised. We have about 40 minutes left. So let's try to get through as many folks as we can. We have Kane, Samantha, Laney, and parents of Mahira next. So next we have Kane. Good morning.
Good morning. Hi. So I'm going to start off. Thank you all for your hard work. You guys have been amazing. This is not easy. I've been watching the news like crazy. That's just who I am. I've been following you guys. I know that there's a possibility of, I've been watching the numbers. First of all, I think that I was a hybrid to go back to school and also with online learning, but I really feel that, you know, Somerville, and there's so many surroundings that are going to be doing fall completely online. I think that's the safest, so we don't have to worry about the MBTAs. We don't have to worry about how many kids are on the buses and wearing face masks. I have 2 kids, one who's in the lower level, and he's wearing his face mask like nothing because I've taught him that over the summer. But what's to say when they go in the classroom and they're close on top of each other where, and I know they said that they're going to be well ventilated, but I really feel that they should have those who have the disabilities to kind of get in there and have those classes that are well ventilated for those who feel, I've been watching, you know, SpedPack, and that they say that they really would feel, you know, those who actually work better with them. So they're on a one-on-one and they actually have those classes designed for them specifically. As well, I feel that being fully remote, maybe they can have some Zoom lessons where the teachers are actually in the classroom with whiteboards teaching live and having those recorded maybe so that those who can't make it during the morning hours can get that recording during the evening, and maybe a day out of the week later on where they can have the questions, concerns addressed with the teacher so that they have that one-on-one with them sitting in the classroom, maybe breaking up in groups. What was your concern this week? What can we work on? I also feel that teachers may be getting, some teachers were technology a little bit better than others. Maybe they have like a sit down and have them have some training and help out, because I do know that I had 2 excellent teachers and I mean, they were amazing. Not to say that, you know, one's better than the other, but maybe they need that extra help. I know I do sometimes. And as well, I'm going to finish on this one. If they do bring in hybrid, I feel they shouldn't have any gym any contact, no moving around. Go in for their lessons, let them learn, and then be released for Zoom workout later while they're at home. And that's kind of where I'm at. I just wanted to make suggestions, if anything, because I do have nieces who have asthma and all that, so they're scared about that, but that's it.
Yeah, thank you. Those are good suggestions. Appreciate you sharing those.
Next, we have Samantha Laney.
Hi, I've got a lot to say and I apologize, so I'm going to try to say it fast. My name is Samantha Laney and I teach inclusion special ed in Boston Public Schools, and I want to make something clear that the picture that is being presented is not the full picture. The teachers union, if you're talking about actually working with teachers, is unanimously clear that virtual learning is the only safe way to go in the fall. A parent in this meeting previously was concerned about special ed services, and I urge you all to read the Boston Teachers Union proposal for reopening schools. It outlines an opportunity for one-on-one in-person optional meetings during an all remote model and other improvements on virtual learning. I also want to echo what another parent said, that this hybrid model will render both in-school and online learning significantly less effective than it was previously. And to definitively answer that parent, yes, your student will be learning from a teacher with a mask through a screen who will have to walk away sometimes. My questions, however, surround accountability. You say that we will have things like masks and hand sanitizer, but for years it has been a teacher's joke that BPS never gives us enough hand soap. So how, even if on paper we have all of these things, will the district actually be held accountable for providing them? My second accountability question surrounds kids. You can put all the signs and regulation in place that you want, and a substantial amount of kids will age appropriately completely ignore them. There is no way to guarantee that students will follow a single protocol. So short of running our schools like a joyless prison, we can't enforce these guidelines. So what is the plan to hold students accountable when age-appropriate behavior is suddenly considered potentially dangerous? You also keep referring to keeping the windows open as proper ventilation, which it isn't. And also, what if they're on the bus and it rains? Sorry, that's all I have to say. Thank you so much for letting me talk.
Thank you, Samantha.
So those are comments that I've heard from the teachers in some of our working groups, as well as I did read the teacher outline of things that they would like to see considered as we begin to continue to do the planning moving forward. So we have all of that. Much of that is also at the negotiations table. So we're discussing that in terms of working conditions. As for cleanliness, I know that the district has a very little trust regarding the cleanliness of our buildings, but I assure you we've hired more custodians. I noticed this even when I came last year prior to COVID, and so we added 25 additional custodians, and we will be adding more if necessary in order to keep the buildings clean. Again, I did say that it will be an all village type of program for us. So we all need to, be reminding ourselves to fill the soap bins and have it available, but there will be plenty available. We've already ordered that for our schools. So it will be up to the principal and the school superintendents to hold them accountable for the cleanliness in the buildings. And maybe a few other things that we're looking to do in terms of surveying our staff and making sure that we have proper ways for them to give us feedback if it is not.
Thank you. So the next three hands we have raised are parents of Mahira, Kim Miller, and then Angela Rubenstein. So parents of Mahira, hi, good morning.
Good morning. Actually, I don't have that much question. I have some suggestions which you can consider for your further meetings. Like we have already experiences of remote learning already, and Boston Public School is already done last year's one. I think it was not fully satisfactory, but it proceeded on. And so far we know some of the other school districts side by Boston's, like Newark public schools and all, they are also opening, like it's a mixed culture, like 2 days off, 2 days on, 1 day off, like this way. So my suggestion is like that, there is not only the kids, they are going on the way, but the teachers, there are a lot of elderly teachers, they are asset of Boston Public Schools. So their lives matters also. So we don't want to lose any experienced people in this pandemic. This is my number one thing, observation. Another one is we can look after the couple of other public schools observation, how they are doing, maybe for 2 months, because this virus is a cluster of 14 or 15 days. So we can wait for 2 months, that means 4 cycles. What is happening in the other public schools? What is the outcomes? It's like selfishness, obviously, but we can observe the other public schools, what they are doing. Is there too much contamination, or the people's kids are becoming sick, teachers are becoming sick in other public schools, those who are opening eagerly. So then I think Boston Public School can reconsider, and they can think about opening like mixedly, like 2 days on, 2 days off, like this way. Because for fully opening, I think it will take a lot of efforts and a lot of things to be improved. So even if you like to open like half a week, like 2 days on and 2 days off, that means you are telling hybrid. So you may reconsider it maybe after from the November it can be done. Then winter is not there, but it's already cold. Because if start contaminating with the kids, like which we observe in London, in other countries, we have seen that school has opened and the kids and the teachers has started becoming sick, then it can be a pity thing for Boston Public School. So I will request all of you to think, and actually my suggestion is like that you can consider this thing when you are going to the meeting with the mayor and as well as governor. I think they will understand this thing. This is not too much tough decision. So it's a matter of life of teachers and those who are working in the back, as well as you people, because now you see we all are talking from our home. So everybody is not, or not, we cannot tell that everything will be okay from in the month of September. So it's
Thank
like
you, sir.
last year.
Thank you so much for your suggestion.
Okay, that was all from my side.
Thank you so much.
Yeah, you know, one of the things that we have been considering all along, again, these have been drafted plans we presented the framework on July 22nd of all three, because they're all three are required by DESE. I think there's been some misunderstanding out in the public that because we spent a lot of time explaining the hybrid, that was the preferred choice. It was a framework that was presented. These have always been draft plans. But we had to explain what it would look like. So it took a little bit more time to explain that than all remote, because we've already done all remote. So no need to explain that as much to the public because they know that, but nobody had ever had any time and attention to hybrid. So we spent a lot of time explaining that. And I think people thought that because we spent more time explaining that we had our minds made up. We do not have our minds made up. This has always been a draft plan. And, we just want to make sure that the public understands both what that means. And actually all three are required to turn into the State Department and to the commissioner. That's why I said that they are part of this decision-making process, because, the governor himself could just say all schools are going to be closed. And so all of those different layers impact the final decision that Boston Public Schools will make. But you make a very good point, and there's other options of phasing in. We've also looked at different populations, like some of the callers have said about some of the students who might be high needs. If we could figure out how to do that safely, we would like to do that. So all of that is on the table for how we think about starting school. Do we start on September 10th? Do we start at some later date? Do we try parts of hybrid? Do we, try to do all remote and then try to do some like other districts have already announced? Boston Public Schools is the largest school district in the state. And we want to make sure that we are doing our due diligence and deliberating all of this community feedback and deliberating all of the science and making sure that we are prepared. And we have said all along, we will not open these doors unless we can say that school is safe. And so we want to make sure that we are ready when we do actually open up our doors. And so I just want to make sure that the public is very clear that this has been draft plans all along. We are taking the feedback and have been actively taking feedback for several months, but more in earnest the past since July 22nd with our union partners, with looking at everything on the table. And, I know people have very passionate positions on one way or the other, but it's my job as superintendent and to collaborate with the state partners and with the city partners and with the mayor and with the school committee to have done our full due diligence of listening to the community, to our union partners, to our teachers, to our parents, to our students and our family members before we make any final decision. And we really believe that to get our buses rolling, we would need to make that decision very, very soon within the next week or so.
Thank you, Dr. Castellius. And we're doing pretty good on time. We have about 25 minutes remaining in the meeting, but we also have 50 hands raised. I know that we won't get to each and every question, so I do want to make this announcement now, and I'll make it again later, that you can continue to stay engaged with us by emailing reopening@bostonpublicschools.org. We'll throw that in the chat so you can see that visually, but in the meantime, we'll continue on with our Q&A.
Thank you, Jelani. Next up we have Kim Miller, then Angela Rubenstein, then Jade Watt. Hi, Kim.
Kim, you need to unmute yourself. Kim, are you there? Kim, if you're, just in case you might be struggling with trying to unmute, just look for the mic icon at the bottom of your screen and then just click on it and you'll see the line go away from the mic.
Okay, Kim, we're gonna have to move on to another hand. Okay, Kim, I'll try to come back to it before we end.
And Kim, if you, because we weren't able to get to you again, you should email us at reopening@bostonpublicschools.org so that way we can see your written feedback.
Angela Rubenstein. Good morning, Angela.
Hi, can you hear me?
Yes, we can. Good morning.
Hi, good morning. Thank you so much for this opportunity. I have a child at the Bates, and I want to say the teachers and staff there did such an excellent job supporting students and families with remote learning last year. And we already know we're not going to be sending our child to any in-person learning this year due largely to the condition of the school building. I know that the Base is like a lot of the other kind of outdated buildings that just don't seem like any amount of quick retrofitting will make them safe places, given what we know about the importance of airborne transmission. And I kind of think as we look at the rates in Boston, it's becoming more and more clear that most students, are going to need to be remote this year. And I've heard so many creative solutions from other school systems, from Boston parents and teachers. And I feel like we're wasting time talking about kind of what seems like a more and more far-fetched hopscotch model, where I'd much rather be talking about how to use the buildings that have modern facilities and use some of our buses to prioritize the kids with the highest needs, the ones that need special ed services, the kids are in families that are not in stable housing situations, who could really benefit from some small group face-to-face interaction in buildings that lend themselves to being able to do that safely. I'd also love to hear more about how we're supporting teachers to really feel equipped to do high quality remote learning, and how we're supporting families to have the materials that they need. I'd love to hear more about creative solutions for helping kids and families form connections to each other in the beginning of the year before the weather turns, and how we could use outdoor spaces at some of our falling apart buildings like the Bates. I'm really anxious for teachers to have more clarity about this and for parents and families to have it. So I'd love if we could talk more about what we really think is going to happen instead of trying to work out the details of things like having teachers teach online and remotely simultaneously, which just seems frankly patently ridiculous. Thank you so much.
Thank you, Angela.
So I very much appreciate all of those questions and also respect your decision to keep your child at home, given the condition of some of our facilities. I too am very worried. One of the things coming to Boston around our facilities and the condition of our facilities is why I asked the mayor for $10 million for a 3-year plan for potable water in our schools. I was pretty shocked that we didn't have clean water for our kids. And then also upgrades to our bathrooms and upgrades to our entryways, our lighting, and just the, the overall cleanliness with the addition of the custodians. So that was already put into this year's budget prior to COVID, because those are things that I lifted up and asked the mayor if we could do, and he was very supportive. As for the plan for the fall, in terms of your ideas, those are all really great ideas to use some of our 32 buildings that do have HVAC systems differently to be able to route students there and see, could we use those? I've heard some of those ideas before. I don't think we're wasting time. I know that people are very impatient and I'm just as impatient. I really, really am. And I feel for parents, but we have been doing all of this planning. We have 135 school buildings that we have to walk and understand and know, and all of the faculties in those buildings, need to have time with their principals. They're all still on summer vacation. So we need to get them back in our building so that we can get all of these great ideas and plans together for their school specific plans. And then they are going to be planning open houses, probably virtual open houses. They may have some outdoor opportunities. I know a couple of our schools are already doing some very creative outdoor at the park get-togethers that are socially distanced. So there will be that kind of creativity, all our fabulous school leaders and teachers, as we try to rebuild community and connect with one another. We're not going to come back to school either remote or in person and not take time for the social emotional well-being and reconnecting that we need to do as a community. I'm talking about this a lot. Teachers will have professional development and professional development days in order to be able to do this. And also our school leaders will be finding opportunities to be able to connect at their equity roundtables and their parent council meetings to really try to get the right types of supplies for our students. We know that students can't share supplies, so they will have to have either at-home supplies and also the supplies in school. So that is going to be another big added expense. Where I can use all of your help is to help us continue to press upon the state and the federal government to fully fund public education, especially in COVID, because all of these huge expenses, providing the PPE for kids and families who can't afford to provide their own, providing it for our staff and our nurses and the special PPE that's going to be needed for that. All of that is hugely expensive. Transportation is hugely expensive. All of that is going into our planning and whether we can and cannot even afford it. So that just is taking more time because of the complex nature of Boston Public Schools compared to other school districts who maybe have, one high school and a few middle schools and 7 elementary schools. It's just much easier to do in smaller communities, but in the complex nature of an urban school system, very different protocol and very different equity impacts that we have to consider as we make these really tough decisions. So outdoor spaces, at-home learning kits, those are things that we are really going to be trying to work with our partners to help us out with, and small group opportunities with Boston After School and Beyond and some of our nonprofit community-based partners. And how do we do that in a very creative and innovative way to still build community?
Thank you, Dr. C. We have Jade Bethany and then Prince Charles Alexander. So next we have Jade Watt. Good morning, Jade.
Good morning. First of all, thank you to the superintendent and all the work that you and your team are doing. As parents, we know you guys are working around the clock to figure this out for the safety of our students and our teachers, so thank you. 2 quick questions. Really, when can parents expect the final decision on what the plan will be? I think the superintendent alluded to maybe in the next couple weeks, but is there a date you can give us parents so that we can start planning accordingly? And then the second question is, if a student and or teacher becomes sick with COVID, what will be the protocol in that school?
So we have to turn in our plan to the commissioner Friday, August 4th. So that is absolutely a date where you will have a strong indication on what we are looking to do. And so hopefully by August 14th, we will have a clear direction. But again, I qualify that only because no matter what direction that is, it could shift based on the incidence of COVID. These things are evolving and emerging all the time, and we are going to have to continue to pivot back and forth, back and forth, back and forth based on what we know about the science and around the medical advice that we're getting from our medical professionals in Boston Health Commission. That's what's been so tough about nailing this down and nailing down a date, is because we really want to watch it. You know, if we had said 2 weeks ago, we are for surely going hybrid, we may be coming off of that if the numbers in Massachusetts and Boston go to such that we need to be remote. That is why the state has required us to put in these 3 plans and indicate, you know, which is our most preferred plan. So I just want to make sure that that's clear. And then the last question was, what, I'm losing it now. It was about the date, and then one other question she had.
Protocol. The protocol for if someone gets sick.
If someone is ill, we ask them to go home. If they have there will be a protocol for our school nurses, and if our school nurses believe that that is COVID-like symptoms, they will need to have a negative test on the way back if they have been tested as positive for COVID.
Thank you, Dr. Caselius. Right before we get to Prince Charles and everyone else's questions, I do want to give Alba an opportunity to read one of our pre-submitted questions, and hopefully this is a concern that or can be answered for some of the other people who are waiting to have their hands called on. So Alba.
Yes, so this is regarding childcare. If we have 2 children in the BPS system and a hybrid model of learning, can both children do the same day in terms of in-person learning to ease up the childcare burden?
That's a really good question. So we have worked with our data systems to look at where we have siblings and tried to match those siblings on the same group.
Thank you, Dr. Caselius, and thank you, Alba.
Next we have Prince Charles, Tammy, and then Terrell. Good morning.
Good morning. How are you?
Doing well.
Good. I teach at a college. I use all kinds of technology. I have twins entering the 4th grade AWC at the Orenberger. We have 2 Chromebooks that we started using in March. They're family owned, and my children were complaining during the spring semester about stuttering audio and freezing video on the Zoom platform. So obviously this affected the educational experience for my children. I tested the internet connection, the speed several times. I finally went and bought iPads. And the iPads work a lot better. They're effortless, they're seamless. Everybody can't afford to do iPads. So my first question is, are Zoom and Chromebook conversations being had with manufacturers with this kind of feedback in an effort to make the learning tools more robust? My second is, are the BPS teachers in Zoom training currently? And if not, when is that going to happen? And my third question, are the people responsible for IT in training right now? Because they weren't helpful during my troubleshooting of the stuttering audio and freezing video. Thank you very much.
Thank you.
Yeah, so we're trying to better understand speeds and quality, and we can see that on the back end of our technology. It's a new technology that we just got in June to better understand if students are using telephone, if they're using a computer, an iPad. We can see that when they sign on to their Gmail and Google account, and we can see their speed, so then we can troubleshoot. So that's a new technology that our IT and digital team is actively working on. As for professional development, that's ongoing. All summer we've had professional development available. It is not mandatory. At this point, we would have to negotiate that with our union on mandatory days and hours, which we are doing. For remote learning, we were able to mandate 5 hours of professional development on remote learning and technology access and how to teach with technology. We anticipate there will be more that we will be able to ask the union for in terms of their professional development. We are also increasing our digital learning team and integration specialists who can work and do this type of professional development throughout the year. So those are things that have been going on. As for the type of technology, you know, we have invested in the Chromebooks, and that is the technology that we are configuring right now. We have not invested in Apple technology or iPad technology. However, it does work on our platform if parents so choose to purchase that.
Thank you, Dr. Caselius. And I want to be mindful of time. It is about 11:20. We have 10 minutes left in this meeting, so we will probably have an opportunity for time for maybe 4 or 5 questions to be asked and responded to. So just wanted to put that out there.
Tammy, next we have Tammy.
Hello guys, my name is Tammy, and I just have a few questions, but like I'll be quick with the first one. As you mentioned that you're trying to introduce a lot of like, you know, other resources to help the students with remote learning. However, you never really mentioned what type of resources it is and how you're going to get these resources. I just want to suggest that, like, you know, there is colleges that are training, that are training teachers or soon to be teachers. Try to reach out to them, ask them if they have any students that don't mind doing tutoring for students. For like BPS students over Zoom, have a list of, like, you know, tutors, like, you know, available for that. And you can maybe have them count, like, you know, talk to the university, see if it can count as credit. Another thing is, right now we're pretty much preparing our kids for college student lifestyles where it's like online, everything's online, they have a schedule, but yet us parents don't know what their schedule is. It's hard for us to make sure they've done their homework, they went to their class, if we don't even know what their schedule is. Like, I understand last year it was very sudden, so switching was very quick and it had to just like be a quick adaptable thing. But like this year coming, I feel like all parents should be able to like have kind of like a college schedule where it's like Monday, like this time slot is for English, Tuesday, this time slot is for that, if it's remote. And on top of that, I would really like it or appreciate it if we were given kind of like a breakdown plan of what our kids are learning, what they're gonna be learning every single day, and what work is expected to be done, what goals is expected to be made, so we can actually help them now that they're home. And like they might not be able to get resources with extra time with tutors or extra time with teachers or anything. And I totally agree with all the parents. Remote learning is the way to go to keep all our kids safe, and just offer in-person learning for like kids with definite, you know, special needs and the problems at home and like, you know, shelter issues and everything else. So how would you be able to offer those resources? Such as like scheduling for us parents, so we know and help and can assist students.
Can we give the superintendent a chance to respond? Thank you.
So one thing is, I did talk about at-home learning kits and supplies. I know that that's one area that people would really like to have some help with, especially families who can't afford it. And every year we have partners who step up and help us with that. They do backpacking, churches do backpacking. We're going to try to be more intentional about those partnerships to try to get help with those at-home supplies. As you can imagine, that's a huge expense to the district to do both at-home and in-classroom supplies. So we're trying to figure out just how to do that. We do not have that yet figured out in terms of the expense, but we are committed to trying to figure that out for families. Second, teachers that go on vacation after the last day of school is, you know, June 22nd until they start school September 8th. So I cannot make them do professional learning, but they all know that we are going to be doing remote learning no matter what, because we always have the option of families to do remote learning. So there's nothing that has stopped any teacher from signing up for district-wide professional development around remote learning, or improving their practice around remote learning, or sharing best practice with one another. And I absolutely know that lots of teachers did spend a lot of time this summer on their own, figuring that out, or attending a district-wide professional learning opportunity to better their practice. So I don't want anyone thinking that our teachers are not working hard all summer to improve their practice with remote learning, because they all know that they were going to be doing some level of remote learning because that was the option already, and they knew that they were going to be a one-to-one technology district now. So these are new tools that they have for their practice. So whether we're all remote or hybrid, they don't know, but they knew for sure that we would be doing something around remote learning and around using technology. So I'm certain that they are improving their practice and will be much more intentional as they return back to school after September 8th. Then also School Without Walls is kind of what you're talking about with the scheduling, and that is like kids can take any English class or any remote class. We are exploring like a virtual school, and what does that look like in terms of students being able to take classes that are outside of their school their school community or from their own teacher. And so what are those other opportunities for students, more like a college type of schedule that you mentioned? That's more at the high school and secondary that we are exploring that as part of our high school redesign. ALE Secure, who is a co-chair of our Opportunity and Achievement Gap office, has also been exploring a design model called School Without Walls, which could address some of the suggestions that you were talking about. And then I think you asked about at-home learning and just improving that. The best way to improve at-home learning right now is for teachers to learn from other teachers and create opportunities for them to support our families and support our families through our Family Advancement Office with additional supports for families on how to get their kids signed on, how to understand what is going to be coming ahead of time. We talked about Friday, a letter that goes home to families in our schools that tells them what to expect the next week coming up. Each school does their own planning. So these are really good conversations for parent councils to have with their school leaders and their teachers about what kind of things go home and how they know what the lessons are going to be. We will have a scope and sequence around what's expected from the district level, but of course, Boston Public Schools has a lot of autonomy, meaning schools basically make these decisions on curriculum and scope and sequence at their school site, and it's not district led. We will have that scoped out for them, but they still currently have the option of doing these things at their school site that are different because of the different autonomies that they've been given and their different governing boards.
Thank you for that, Dr. Casellia. So we have 39 hands up and we only have a few more minutes left. But I just want to note that my colleagues have put in the chat the reopening email address where you can send your comments, your suggestions, and your questions to. We're going to take Taro, if I'm saying your name correctly, and then we're going to take Sherry Williams, and then we're going to close out for today. But please know that we will be continuing this conversation. Taro?
Yes, good morning. Hello. Thank you so much for having these sessions. The city has shut down streets for restaurants. Has there been discussion of doing the same to set up tents and allow more outdoor classroom space for our schools while the weather allows, especially to help build a relationship between new students and new teachers at the start of the year? And a second part of this is also for those schools that already have facility reports that deemed their ventilation systems deficient. Has there been any progress to fix more than filters and windows over the summer, even reaching out to local businesses to see what donations and designs or materials might be possible? Thank you.
Yeah, we have been reaching out to partners and working with our partners around supports, so that's ongoing. As for the ventilation systems, we've been doing assessments in all of our buildings around ventilation, and that includes fixing windows and HVAC system filtering, and so that's part of it. As also, there's been conversation around fans and air filter, air movers or whatever they're called. I'm not an expert in that area, so there's been conversation about that to improve quality in some of our buildings where we would need it to move the air better. So yeah, that's been going on. And then she had one other question.
Outdoor space using tents.
Oh yeah.
For
So
outdoor space.
Yep, we did talk also about tents, and obviously many of our schools have upwards of 100, 200, 300,000 kids, and I just don't know that we could have enough tents outside of those spaces. A small restaurant can have a tent put up or umbrella or something like that, and it's like 50 people, but for a school it's fairly unrealistic to have tents around the whole entire school system.
Thank you. Next we have Sherry Williams, and this will be our last hand for today. But again, there are other ways to engage and get your thoughts and concerns shared with district leaders. So next we will have Ms. Sherry Williams as our last comment for this morning. Good morning, Ms. Sherry.
Good morning. So my question is, you have older kids and young kids share a school bus and also a wheelchair. How many kids will be on the bus and how will they be spaced out?
Every single bus has a different size capacity because we have little buses and big buses, and even the big buses have different lengths and sizes. So students there can be one person on a bench for every bus. And so they'll have one by the window, and then the next one will be by the aisle, and then the next one by the window, and the next one by the aisle. That's the current CDC guidance, and windows have to be open for airflow. And they recommend that every school bus has a monitor.
Jelani, closing out, Dr.
And
Caselli.
then students have assigned seating.
Thank you very much, Dr. Casellius. Thank you to each and every one of you as family and community members for taking time out of your Saturday morning to be present with us for this community conversation. Again, it is ongoing, and for those who we did not get a chance to hear from, we apologize, but again, just wanted to reiterate the couple of different ways that you can stay engaged with us going forth. We do have a page on the BPS website devoted to reopening and reopening information. And so you can find that at bostonpublicschools.org/reopening. And you can also email questions, comments, feedback, and suggestions to reopening@bostonpublicschools.org. And so we thank you for bringing your comments, your questions, your concerns here this morning. We truly value and appreciate everything that you've shared and take into consideration all that you've experienced between March and now, and we look forward to continuing to converse with you as we move along in this process towards reopening of schools, and of course once we are in the school year. But in the meantime, I want to thank Monica Roberts and again Dr. Brenda Caselli, our superintendent, Dr. Brenda Casellius, for being present with us on this call and countless other meetings that we've had, and to all of our other district leaders. Thank you to the community engagement team, my colleagues, for helping to organize and to get this set up. Again, 32 meetings in and over 3,000 people engaged. And again, folks, this is not the last conversation. We look forward to conversing with you more. But in the meantime, we hope you stay safe, stay healthy, and have as enjoyable of the rest of the summer as you can. And we look forward to engaging you at future conversations. So with that, we say goodbye and thank you.
Thank you, everybody, and thank you to the team. Have a good rest of your weekend.